Good morning, I'm Dr. Levi Doe here at Pine Cove Dental.
Hi, I'm Patricia Martinez, and I'm Dr. Doe's dental hygienist.
That's right, she's a hygienist. Do you guys know that? Hygiene is very important, and this happens to be Dental Hygiene Month. So we're going to go over some very interesting information about, the importance of keeping your mouth clean, and the hygienist has a lot to do with that, right, Patricia?
Yes, that is my wheelhouse. That is what I do.
That's right. So we're going to help you to answer some commonly asked questions. And one of the most commonly asked questions is,
why do I have to go to the dentist?
that's a great question.
Yes, it is.
Yeah.
Yes. Well, you go to the dentist so that we can take a look at your teeth. We can see what's going on in your mouth and let you know if you have any cavities, if you have gingivitis, if maybe you are starting to develop periodontitis, or maybe if something that's going on with your medical history is affecting you orally. There's so many things that we look at and we educate you on.
That's right. So if you like to eat and you like to smile and you want some teeth, you kind of need to go to the dentist because we keep your teeth healthy, right? And not everybody needs to go to the dentist, only the people that have teeth, okay? So as long as you have teeth.
So at your dental appointment, you can expect us to review your health history with you. So that's the very first thing that we do. So I review Dr. Doe's health history with him, any medications he might be on, and any correlations there might be with his medications and his oral health, or and how it might affect his oral health. So we would take his blood pressure, and so we would do that. And then after we review the medical history, we will then take his dental x-rays. We do that digitally these days, so there's very little radiation used, which is always a big concern with most patients, is the amount of radiation you're exposed to. And as you can see, his x-rays that were taken, we display them on the screen for you to see so that you know what's going on as we take them. So another important part of what we do, we not only check what's going on inside your mouth, but we check what's going on the outside as well. So we check externally, open, we check the jaw, close, open, close, and then we check all the way around to see if there's any lumps or bumps that shouldn't be there. Open up. So this is how we just do an oral cancer screening. We also utilize the Velscope in our office as well. The next, it is important for us to take a look around at your gum and your teeth. Turn this way. We do something called probing, and we are checking for, it gives me an opportunity to look at your gums and see how well you've been brushing and flossing, but also to check your gum health by taking some measurements with my special little instrument. It's like a little ruler. Ideally, we would want this number to be 3 millimeters or less. We just measure all around. We take 6 measurements on every single tooth in your mouth. To clean your teeth, there's a couple of ways that we go about it. We have our dental instruments, which are these right here. We have some that are made to clean your front teeth and some that are made to clean your back teeth. I am cleaning 2 different things, well, 3 really. There's what you can see, which is the plaque. It's the soft deposits. Plaque builds up on your teeth on a daily basis, but you brush it off. Every day you brush and floss, you are taking the plaque off your teeth, or you should be. Then there's tartar. Tartar is the hard calcified deposits that accumulate on your teeth. And that, once it develops into tartar and sticks to your teeth, the dental hygienist has to take the tartar off. Then it has to be physically removed and scraped. And that's done either with our instruments or with the ultrasonic scaler.
Nice.
But then the invisible and probably the most dangerous out of all of the things that we take off your teeth, and the most damaging, I should say, not dangerous, damaging, is the biofilm. Biofilm is bacteria. It's a thin layer of bacteria that develops on your teeth. And if you do not disrupt that biofilm on a regular basis, that's when gingivitis starts. That's when you start to develop gum problems and you start to see bleeding. And so it's real important to get in there, not when you're brushing and flossing to disrupt that biofilm, but it's also a big part of what we do when you come in to see us. We are primarily looking for, or one of the bigger things that we're looking for is called tartar. And tartar is the hard calcified buildup that accumulates on your teeth. There are common areas in your mouth. It's these lower front teeth on the inside and on the upper teeth on the outside. And that is because a lot of the minerals that help build tartar are in your saliva. And your big saliva ducts are underneath your tongue. And so these teeth are constantly getting washed over with saliva. And so that those little minerals stick to those areas. So we go in there and we take that off. It's important because this is a hard, crusty buildup on your teeth. So it not only can physically irritate your gums, it also can cause heavier bacteria because the bacteria sticks to that, and then it causes more inflammation, and then you start to see bleeding. And eventually, the only thing that the gums and the teeth can do, if this tartar remains on your teeth and is not removed, is to move away from it. And that's a very natural reaction. And that's when we start to see recession, where the gums are moving, and we start to see bone loss, where the bone migrates, because it's just trying to move away from this bacteria that you have in your mouth. In the ideal situation, it really shouldn't be painful at all. And when you go long periods of time without seeing the dentist, there's more of a possibility that things are going to be uncomfortable because there'll be more inflammation, there'll be a lot more sensitivity on the patient's end. For a patient that comes in regularly, where we've got all that under control, there's a lot less tenderness and a lot less sensitivity. But there's quite a few factors that go into play with that. So ideally, no, it shouldn't be painful at all. But can it be uncomfortable at times? Yes, it can be. At the end of the appointment, once we've cleaned all the plaque and all the tartar off your teeth, then we use a gritty toothpaste with a fine grit to smooth up anything else that might be left behind. You can think of it as a fancy way to brush your teeth. But we polish them to make the tooth surface as smooth as possible, because that makes it a lot harder for the bacteria to attach to. And this is typically done at the end of the appointment. We demonstrate to you how to floss if it needs to. We demonstrate to the patient if we need to, but also to remove any of the grit from the polishing that we used from in between your teeth. I say probably 80% of the time you can tell. There's those few exceptions to the rule, a patient who does absolutely nothing and their mouth looks okay. No, but yes, the majority of the time, yes, your gums are red, there's more buildup, there's more bleeding, there's obvious signs that you are not doing your part at home.
So at the end of your cleaning appointment, or if you're here for the first time, I'll be in a little bit earlier. The dentist will review with you the X-rays. So the X-rays are going to show us, the condition of your teeth. If there are any fillings in there that might have disease in there or decay, and also we can look at your bone, including looking at a 3D scan of your jaw as well, called CT. So that will allow us to pick up any small bacteria infections on your teeth before they turn into an abscess or a full-blown infection. Therefore preventing really bad pain and also breaking off your teeth. So another cool thing is we can take pictures of your teeth, of broken fillings, of large fillings, of cracks on your teeth, and also allow you to see how well you're brushing. So think of us as your dental coach, allowing you to take better care of yourself, and be able to have an idea of how well you're doing or not and areas to improve upon.
Okay, and at the end of our cleaning appointments here at Pine Cove Dental, we always offer our patients a warm scented towel so that they can freshen themselves up after their dental appointments. Whether it be a cleaning or filling appointment or extraction, we offer this to you every single time. And how was your cleaning today, Dr. Bell?
It was great, no pain at all. And yes, even healthcare professionals need healthcare providers to
Yes.
stay healthy. So, all right, thank you for watching this video. I hope you guys find it helpful. Obviously, it's very important to find out more and just to be proactive about your own health. And if there's anything we can do at Pine Cove Dental to help, leave it in the comment, any questions you have, and then feel free to reach out to our office so we can help you get back on track. So stay tuned for the next video.
Okay.